The symptoms of someone who might need a knee replacement are the symptoms of arthritis of the knee. Arthritis is a degenerative condition where the cartilage wears away, either from injuries or trauma or certain other diseases like rheumatoid arthritis or osteoarthritis, where basically cartilage wears away. When someone is a candidate for a partial knee replacement, generally this process is limited to the medial or inside part of the knee. That's the most common area for people to develop arthritis. And in order to be a candidate for a partial knee replacement, people generally would have to have arthritis just limited to that part of the knee and not have extensive arthritis in the entire knee. So the symptoms they're going to have are going to be mostly pain, and pain that is localized or located only on the medial or inside part of the knee rather than throughout the knee. When someone has arthritis of the knee, generally the decision to come in for treatment should be based on the patient's symptoms. The main reason that we treat arthritis of the knee in general is pain, and pain that's not responsive to normal conservative measures, and pain that interferes with their life in terms of day-to-day activities. So really I leave that decision up to the patient. It's when the patient tells me that their pain and that they've had enough pain and they want something done about it. I always tell my patients that I don't operate on x-rays, I operate on people. So really it's the patient's decision when to have surgery or when to have treatment for their knee rather than how their x-rays look. Treatment of arthritis, in particular medial arthritis, generally can be grouped into conservative versus surgical treatment. Conservative treatment generally involves things like anti-inflammatory medications. We call them the non-steroidal anti-inflammatory medications, such as naproxen sodium or Advil, ibuprofen. There are other prescription type of medications that are useful. Unfortunately, a lot of the patients I see are unable to tolerate those type of medications for one reason or another. Sometimes they bother their stomach, or sometimes they interfere with some other medications that they may be on. Other treatments, conservative treatments, besides anti-inflammatory medications, are injections. Cortisone is one type of injection that we do commonly for knee replacements, and that also decreases pain and decreases inflammation. Cortisone injections, generally we recommend no more than 2, perhaps 3 times per year in any one given joint. There's another type of injection that we'll do. It's called viscosupplementation. It's injections of a substance which is called sodium hyaluronate. And basically, sodium hyaluronate is an artificial joint fluid. You come in for a series of injections. The patient will come in for a series of injections in the knee once a week for 3 weeks in a row generally. And the sodium hyaluronate generally lubricates the knee and provides additional flexibility and can a lot of times alleviate the symptoms that the patient has. And that a lot of times is something that we'll try before we recommend going into surgery. In addition, using a cane is often helpful to relieve some of the weight from the knee. Certainly losing weight is always helpful in patients who are overweight. That puts less stress on the knee. A lot of people often ask about the difference between a partial knee replacement and a total knee replacement. They're both treatment for arthritis, osteoarthritis, or sometimes rheumatoid arthritis. But in a total knee replacement, we replace the entire knee joint. An example of a total knee replacement is this, all right? The total knee replacement is comprised of a replacement of both the entire end of the femur and the top of the tibia, as well as oftentimes the kneecap. Essentially, we shave off the entire end of the bone and resurface it with an artificial metal and plastic bearing surface. A partial knee replacement is different than a total knee replacement. It involves replacing only the damaged part of the knee. For example, when someone has arthritis involving only the medial or inside portion of the knee, we can replace just that inside portion without having to replace the whole knee. This is an example of a partial knee replacement, and on this knee all we do is replace the inside part of the knee with a metal and plastic bearing surface. The advantages of doing a partial knee replacement is the recovery time is a lot faster than with a total knee. The surgery is a lot less extensive. There's less blood loss. There's less time. And to a lot of people feel there's a lot less complications involved in this type of surgery and a much quicker recovery. Patients who have a partial knee, who are candidates for a partial knee, often I see them come back and their gait, they walk much more normally and recover much faster than patients with a total knee. Not everyone will be a candidate for a partial knee replacement. In order to have a partial knee replacement, the arthritis truly needs to be only in one portion of the knee. In other words, if the patient has mostly arthritis on the medial side or inside part of the knee, but they've got a little bit of arthritis on the outside, they're probably not going to do well with the partial knee replacement. In addition, in order to have a partial knee replacement of the type that I do, all of the ligaments need to be intact. In other words, if the patient had an old sports injury and tore their ACL or tore their medial collateral ligament sometime in the past, generally they don't do well with the partial knee and they would need to have a total knee even if their arthritis is only on the inside. So there has to be intact ligaments and truly isolated arthritis to the inside portion or medial portion of the knee. Rehab of a partial knee is similar to rehab of a total knee, only it seems to recover much faster. Typically with a total knee, people stay in the hospital maybe 3 days, perhaps 4 days. With a partial knee replacement, typically people could go home either the next day or the second day after surgery. Their physical therapy is still required, but they generally recover faster. And what I find is that when people come see me at about a month post-op, they generally are walking as good as people who had a total knee are walking at 3 months. In other words, they're about at 1 month at the same place that people with a total knee are at 2 or 3 months. So the recovery is a lot faster. We still have them do physical therapy to get the motion back and to get their strength back, but the recovery is generally much, much faster. I think one of the advantages of St. Luke's is the nursing care, quite honestly. I've been on staff at many hospitals in the St. Louis area, and of all of the hospitals I've been on, St. Luke's has one of the best, if not the best, quality nurses. Over and over again, my patients tell me that they are so happy with the care they've gotten at St. Luke's. And patients I've had who have had procedures at other hospitals generally tell me that they much prefer the care they get at St. Luke's.